Welcome to our first episode of Antibiotic Answers, where we take your antibiotic questions and give short, guideline-based answers while focusing on using antibiotics appropriately and preventing resistance. Please feel free to submit your antibiotic questions to emily.perry@ndsu.edu. Our first question is, when is giving an antibiotic for sinusitis appropriate? Let's do a quick review. Sinusitis is the inflammation of the lining of the sinuses, most commonly caused by viruses, namely influenza A and B, rhinovirus, coronavirus, and RSV. It's rarely caused by bacteria, namely Streptococcus pneumoniae or Haemophilus influenzae when it is caused by bacteria. A key point is that over 90% of cases are viral in origin and will improve on their own without antibiotics. The problem is that even with the recommendation not to prescribe antibiotics, according to the American Academy of Family Physicians, antibiotics are prescribed in over 80% of outpatient visits for acute sinusitis. The solution is to treat acute sinusitis with symptomatic care, such as antipyretics and analgesics, nasal irrigations, and decongestions. So when should antibiotics be prescribed? When there are persistent symptoms lasting greater than 10 days without any improvement, when symptoms are severe with fever greater than 39 degrees Celsius, with purulent nasal discharge and or facial pain lasting greater than 3 to 4 days at the beginning of the illness, and when worsening or development of new fever, headache, or increased nasal discharge is present after initially improving from a viral upper respiratory infection. The first-line antibiotic for pediatric acute sinusitis is amoxicillin, with the second line for pediatric patients being amoxicillin clavulanate. The first line for adults is amoxicillin clavulanate, with the second line being doxycycline, second or third generation cephalosporins, or clindamycin plus cefixime. Some antimicrobial stewardship key points. Only give antibiotics when symptoms persist longer than 10 days. Change in color of nasal drainage is not mentioned in the guidelines for acute sinusitis, and thus it is not an indication to give antibiotics. And azithromycin is not the drug of choice for sinusitis due to increasing Streptococcus pneumoniae resistance across the country. So let's review. The question was, when is giving an antibiotic for sinusitis appropriate? We talked about how symptomatic care is the best treatment for acute sinusitis, and we talked about guideline-based antibiotic prescribing and selection. Thank you for listening, and if you have any questions you'd like answered, please email to emily.perry@ndsu.edu.